Last year, 1 in 10 Hoosiers called 211, and those included people like veterans of the armed services, domestic violence victims, senior citizens, and people seeking jobs.
211 is an easy to remember, easy to use number that provides people in need with information about the programs and agencies that will be able to help them.
For the last 10 years, 211 has been supported through the philanthropic sector, and we have reached our capacity. The ability for 211 to expand, the ability for 211 to become even more effective in the state of Indiana is at its limit. And for the state to provide funding to 211 and to provide that additional capacity will allow 211 to serve even more Hoosiers and in our county serve even more individuals inside Allen County as well.
211 is a way to connect people that are in need quickly, safely, easily to the services that can help them get on to having a more productive and self-sufficient life.
It was beneficial to me because I don't believe I would have found those resources out there. I didn't know who to go to for help, who to ask about it. I just had no idea that the resources that are out there were there. And a lot of people don't.
Currently, the vast majority of the funding for 211 comes from the philanthropic sector. Even though there are state agencies such as the Department of Health, Family and Social Services Association and 911 that regularly refer Hoosiers to 211.
Ideally, I'd like to see 211 be as commonplace as 911. And when people need help, they know exactly where to go, and we can get them the help they need. I don't believe that we should just run to the public money every time, and I know people in the business community would share that thought. But I think in this case, it really is something that should be state funded. And I guess for a business person, I'd appeal to their sense of sort of how do you improve process, how do you improve situations, and really what should government money be there for. This is really a thing to help people get on to self-sufficiency. And we've already proven it with private money donated by the United Way and others that it works, and now it's ready to scale.
It's understandable that people want to cut back government spending, cut back state funds, and a lot of people might view this as a handout, trying to help those that could help themselves. It's not that at all. Really, the whole premise of 211 is to steer these people to organizations, not-for-profits, philanthropic organizations that really choose to give guidance. And sometimes that takes multiple places to go. So you might be talking about utility bills one time, groceries and healthcare. But if you can get those people just that little bit of help, that hand up, to get them back on track so that they can take care of themselves, isn't that really what we're all about and trying to do anyway? We know we need to help folks.
Without government funding, 211 service is not sustainable. We are not asking the state to replace philanthropy. We are asking the state to partner with philanthropy to ensure, through a $3.5 million per year investment, that the services provided by 211 to Hoosiers are not only maintained, but enhanced going forward.
In order to have a community that truly is successful, it has to work for the maximum number of people, and I think that's what 211 is about, and I think the more people that are involved in that, the better our community will be.
Without that help, 211 would not be here. And I mean, it's very important there are people out there that need us. And if they cannot call us to get the help, where are they going to go? What are they going to do?